Hello and welcome everyone to this presentation. I'll be talking about dehydration in children and fluid replacement therapy. This presentation is really a snapshot of the management and practical pearls and tips in treatment. The content of this presentation will be about dehydration, clinical presentation, and dehydration classification and dehydration management and treatment. So when we actually read about dehydration, it looks colorful just like in this slide, and it looks straightforward. And however, in the time of clinical encounter and with the patient presenting, we really have to assess certain points in the presentation. And in history, we have really to look into any signs of decreased intake, and in infants, decrease in lactation, decrease in oral intake, any body fluid losses, whether it's clear to us losses through the GI tract, diarrhea, vomiting, or urinary losses such as polyuria, and in patients who's presenting commonly with diabetes, newly diagnosed diabetes type 1, or skin losses, and either from burns, which is clear and obvious from the presentation, or from fever. And as we know that increase in body temperature above 37.5 1 degree Celsius predispose a child to lose up to 250 ml every hour. So we have to be mindful about skin losses with fever, and we should also ask the parents about lethargy and decreased activity, and we have to inquire about diaper change and if there is any decrease in the number of diapers being changed, and any poor suckling efforts or poor lactation. Pretty much non-specific in infants, and then we have to get into the physical examinations and looking into volume status assessment, skin trigger, and eyes conditions. We have to look into the oral mucosa and check the blood pressure and heart rate, as well as the temperature. And when we are now more inclined to say that this patient is really in dehydration, the most important second question is the classification of this type of dehydration, because it will not only guide our assessment and level of care, but it will also guide our management, whether we need to give oral solutions or IV fluids. So we have really to look into the dehydration classification, and there are fairly three classes, straightforward, and it all depend on the patient current weight in comparison with his recorded baseline weight or estimated body weight for age. And if the difference is more than 5%, so 5% losses in the body weight, and that will be considered mild dehydration. Then if there is 10% loss, or that will be moderate dehydration, and severe will be 15% and above. So we have really to do that calculation, and then the question will come to how to estimate normal weight for age. So if you don't have any records, how would you estimate the normal weight for a child? I just paused for a second so that you can think and reflect about that. There are actually formulas for you to use in order to do that. So any infants less than 12 months, we usually tend to add 9 and divide by 2, and you get the weight estimate. You could do also for children aged 1 to 5 years of age, to add 5 and multiply by 2, and any child above 5 years up to 14 years, you multiply the number of years in age by 4, and then you get your estimated weight, about the normal estimated weight for the age. It's different from child to another depending on the growth and many factors, but it's a rough estimate of their normal weight for their age. Dehydration treatment. So you got your classification done, and you actually found that this child maybe he has having moderate or mild or severe dehydration. So the next step is the treatment. And starting with the mild dehydration, when you find that the child has lost about 5% of their weight and fluids, then you have to think about oral rehydration solutions. And the total volume will be maintenance plus deficits. And if in case this is a GI losses and patient had vomiting, so each vomiting episodes, you will add 2 milliliter per kg, and each loose bowel movement you will add 10 milliliter per kg for losses, and this will total into a certain volume of deficits, and then you will add it to the maintenance. We will talk about how to calculate the maintenance in a few seconds. And for moderate and severe dehydration, IV fluids is the main way of rehydration, and you will calculate the fluid deficits and maintenance, and the total volume you will divide it into 2 periods, 8 hours and then 16 hours. So any patient who is losing about 5% of their weight, you calculate it by 50 ml for each kilogram lost in fluid deficits, and for any patients who have 10% weight loss is equal to 100 milliliter per kg fluid deficits. And that's regarding the fluid deficits. So you will multiply the 100 ml for 10% and 50 ml for the 5% losses. Maintenance is actually based on every 10 kilogram of child weight, and we will talk about it in a few seconds. Now you may thinking, what about severe dehydration? Well, if the child lost 15% of their weight in fluids, and that's considered red flag, and patient will need fluid resuscitation, ABC, and he or she need 20 ml per kg IV fluid bolus over 15 minutes right away, and we can repeat that for another bolus till the child becomes resuscitated, and we do calculation of their weight and check their urine output, and then we'll do these assessments of fluid deficits and maintenance. And I found the best way to understand this is just doing example to know how to calculate the fluid deficits. So you have this child, a 10 years old boy, coming with diarrhea. His weight now is 35 kilogram, and no records really of his baseline weight. He is in your emergency department, and you did your assessment, you took history, you did a physical exam, you think this patient is actually dehydrated. Now, what would be your next step in management? How would you approach this patient? Would you give him oral rehydration solutions? Would you give him IV fluids? How would you think about this patient management? And I paused here for another second just for you to reflect on your routine approach for this type of patients. But the proper way to do it is to first answer the questions about what's the estimated weight of this patient for his age. And since he's more than 5 years, so we will multiply his age number of years by 4, so his estimated normal weight is 40, and he is 35, so he lost about 5 kilogram. And the second question that should pop into your mind is, what class of dehydration is this? So to answer that question, you need to find the percentage of the fluid loss. So he lost 5 kilogram of his weight, and divide that by 40, you get 12.5%. So this is between moderate and severe. It's around the moderate dehydration. So the fluid deficits, as we mentioned earlier, is calculated as 100 ml per kg. So we will multiply the 100 by 5 kilogram, and you get the fluid deficits of 500 ml. So 500 ml is the fluid deficits that he needs. Now let's get the example of fluid maintenance. So you get the same child coming to your emergency department with diarrhea. His weight is 35. No records of his baseline weight. Again, we did the calculation. He lost 5 kilogram and he weighing 40 ideally, so we will calculate the maintenance according to his ideal weight. So the first 10 kilogram, and we will multiply that by 100 ml per kg, and that will give us 1 liter. And then the second 10 kilogram, we will multiply it by 50 ml per kg, that will give us 500 milliliter. And then any kilogram above 20 kilogram, we will multiply by 20, so he is weighing another 20 kilogram above 20, so 20 by 20 will get us 400 milliliter for this child. Remember, it's for ideal estimated weight, so we did not multiply by 15 but rather by 20. So total fluid maintenance in this case, by combining all the numbers for each 10 kilogram, it will get us 1 liter plus 500 plus 400. That will give us a rough estimate of 1900. And now what will be the total fluid replacement? So we will combine both of the maintenance fluids and deficit fluids, the 1900 plus the 500, and then we give it over 2 periods, so we got 2400. And the first period over 8 hours, we will give 1.2 liters or 1200, and the next 16 hours we will give the other 1200. Now what would be the rate of fluids? So you know you need to give about 1200 ml over 8 hours. Now to get the rate, you will actually have to divide 1200 by 8 hours, and then you get your rate of 150 ml per hour. And for the second period is also different, so you will divide 1200 by 16 hours, and that's 75 ml per hour for the second period. This calculation might seem complicated or a little bit difficult or tricky in the first, but as soon as you revise this presentation multiple times, it should make sense. And that's to conclude our discussion about dehydration and fluid replacement. Thank you for attending this presentation, and if you like the presentation, please like, share and subscribe to this channel. There will be another presentation about electrolyte replacement. Thank you so much.